everybody. Welcome to ABA Inside Track, the podcast that's like reading in your car, but safer. I'm your host, Robert Perry Cruz, here solo for a special bonus episode. Now, for those of you who've been listening to our show, which of course is a podcast about behavior analysis and behavior analytic research, you might remember that we did a whole episode devoted to research on school refusal behavior. Diana's not here to tell me exactly what episode it was, but go check the archives. School refusal behavior, if you haven't heard it. It was a nice review of a lot of the work of Dr. Christopher Kearney and his work on school refusal behavior. And it was interesting because it definitely looked at school refusal as a behavior, which meant it had functions. Now, I was very fortunate to be able to get in touch with Dr. Kearney for a little interview to discuss the school refusal assessment development process, some of the issues that come up related to working with younger students and older students who engage in school refusal behavior, and to talk a little bit about the process of updating his book, Helping School Refusing Children and Their Parents, which is now in a second edition. So without any further ado, here is ABA Inside Track's interview with Dr. Christopher Kearney. So we are here talking to Dr. Christopher Kearney, the chair of psychology at the University of Nevada in Las Vegas and director of the UNLV Child School Refusal and Anxiety Disorders Clinic. Dr. Kearney, how are you doing today?
Good. Thanks for having me.
Oh, it is really exciting. We have talked a lot about school refusal. It's been an episode that was very popular when we did it, and it's a real honor to be able to talk to, as I think I said in that episode, the man who wrote the book on school refusal, or at least a book about school refusal. What is your history of interest in school refusal as a topic?
Well, it dates actually all the way back to graduate school. So I was working in an anxiety disorders clinic, and there were a lot of kids that were coming in who were having anxiety-related issues, but they were also having difficulty going to school. And a lot of my graduate school colleagues didn't necessarily want to work with those kids because they were kind of messy. They didn't quite know what to do with them. So I sort of took them into my lab, and I started researching different treatments that were available, but I realized that a lot of what was in the literature didn't really fit the kind of kids that were sitting in my office. And so I took it on as part of my dissertation, and we've developed a lot of assessment and treatment protocols since then and tried to broaden our models over the years. But it's a fascinating population to work with because you always get different cases, you get different circumstances, you get different kinds of symptoms and clinical presentations, so it's always a challenge.
Mm-hmm. Were there any cases that sort of spurred you on to look even deeper in the research way back then, or they all just sort of had that same messiness to them that just sort of interested you as how can we work with these kids?
Well, actually, it was both. I mean, I had some cases that I thought were fairly straightforward if you looked at sort of a pure reinforcement kind of model, but clearly there were a lot of cases, too, where there were a lot of broader contextual factors that were sort of impinging on the case that made them a lot more messy. As you get more into middle school and high school, there's a lot of other kinds of factors that start impinging on these cases, and that's when kids start to get more disconnected from school. So as you get into middle school and high school, you're dealing with a lot more variables, related to family and peers and even the school climate compared to maybe kids in elementary school.
Mm-hmm. In that dissertation work, that was sort of where you started getting the idea, it seemed like, at least looking at the timelines of your original research, for the school refusal assessment questionnaire, or did that date, am I getting my timeline wrong there?
No, that's correct. I mean, that's when we developed it, was back then, and we developed the psychometrics on it over time, right?
Mm-hmm. Was that something that you were, thinking of the kind of the behavior analysis field really clearly, it seemed like? I mean, and that was very early. It was 93 was some of your first work there. And I know that was still when I think the idea of the very structured functional analysis, in even the field of ABA was not a new idea, but a newish idea to some extent. It was kind of just coming back into the mindset of everyone should be doing these FAs and looking at the function of behavior.
Yeah, that's very true. I mean, my earliest roots in clinical child psychology are working with children with autism. And when I went into graduate school, that was my original focus, was working with children with autism and people with profound mental retardation or intellectual disability. And so when I switched over to the anxiety lab in graduate school, I brought a lot of those behavioral analysis concepts with me. And so when we looked at kids who were having difficulty going to school, it became pretty clear that it was amenable to a functional analysis. A lot of these kids were certainly trying to avoid school because there was something about school that was very distressing to them. They were trying to get away from it, either through avoidance or escape. But yet at the same time, there were some kids that were clearly, school wasn't such a bad place, but they were really trying to pursue something more positive outside of the home, either staying home with their parents or being out with their friends or whatever it is that they wanted to do. And so it seemed to be a natural fit. And even the assessment scale was based on the motivation assessment scale, which was it's actually a scale designed to assess the function of self-injurious behavior in children with autism and other developmental disorders. And so we found that it seemed to be a pretty good fit even to this population. It's not a complete fit once you get into more intricate kind of cases, and like I said earlier, middle schoolers and high schoolers, then it tends to get a little more fuzzy. But with more acute kind of cases, especially with younger children, it tends to work really well.
Mm-hmm. In terms of the overall development, how would you say that the SRAS has changed over the years, or has it been just based on your increasing knowledge, just having been a professional for as long as you have, cases you've worked? Like, what are some of those pieces?
Yeah, the items basically surround a lot of what we have seen in the clinic over the years, in terms of what the kids report to us. And of course, we've gone through a lot of different psychometrics. We went through a revision of the scale. And there have been a lot of people worldwide that have tested the scale in different languages. And some have come up with, slightly different versions based on cultural norms or based on some of the language that's in some of the items, which can be a little bit more tricky for younger kids. But I think the basic structure of the scale has remained the same, and it focuses on the four major functions of difficulty going to school, which is either the child's having a lot of difficulty with general distress at school, they're avoiding general distress, or they're trying to get away from aversive social or evaluative situations at school. And then on the positive side, it's those kids that are pursuing more attention from parents or others, and then those kids that are pursuing more positive, tangible reinforcement out of school.
Now, I have a question related to the first function in terms of the distress around content of what's happening at school, and certainly in the book and in some of the original research, there's that kind of description of in its negative reinforcement. The child's trying to escape something related to school. Now, having myself not as nearly as much as you have, but having worked with some older students with school refusal, it doesn't always feel to me that same sense of, it's an anxiety or they have a stress around the school so much as they just actively don't want to do it. Do you find that there's a distinction between that I want to escape just because I don't like this versus the students who say are really engaged in escape to avoid an anxiety around that? I mean, is that a distinction that you would even make?
I agree that there's a lot of overlap between the concepts that you just mentioned. So for the younger kids, they can't usually articulate exactly what it is that they're concerned about with respect to school. So if you ask them, what are you worried about or what are you afraid of, they usually don't know. Now, I can tell you that over the years, what we found is that for a lot of these kids, it's the transitions between one class and another, or it's any kind of unpredictable circumstance at school. So, for example, they had a substitute teacher, or there was an assembly that day, and it kind of threw off their routine. So a lot of those kids, it's not necessarily something they can pinpoint, but a lot of times they clearly feel upset at school. So they're crying a lot, usually to the point where they can't be in the classroom, they can't focus on their schoolwork, or they're sitting in the nurse's office all day. And so whether you want to call it anxiety or distress, or I just call it just general negative affectivity. I don't even try to really pinpoint it with the elementary school kids, because it's really a combination of all those miserable kind of feelings that they're experiencing.
Yeah.
And with younger kids, it's really hard to tell the difference anyway between things like anxiety and depression and general distress and worry, so we just kind of lump it together in terms of general distress. And that actually lines up pretty well with the historical concepts that have been developed in this area over decades, where one clear set of kids tends to be more the neurotic type or the willful type or the upset type, or the kind of type that's more generally described as distress. But a lot of times it's not easy to necessarily pinpoint what it is that they're upset about. And the old term school phobia doesn't really apply, because very few of these kids are specifically afraid of something at school. Sometimes you get that, but more so it's that they're miserable at school. They're feeling really upset, but they don't really know why, but they just don't want to be there.
And would you say that that's similar with older students, or it's a more complicated issue for the high school and middle school students?
Yeah, with middle schoolers and high schoolers, if they have distress about school, it's almost always related to social and evaluative situations. So the two functions are really more developmentally distinct. And so the general distress is usually more for the elementary school kids, but the middle and high schoolers, I mean, probably 90% of the time when they're upset about something at school and it's causing them a lot of anxiety or a depression, a lot of times it's related to a social or evaluative kind of situations. It could be taking tests or having to perform in front of others in some way, or just social interactions with other people, are feeling alienated from others, and so they're trying to remove themselves from that situation because it makes them feel ostracized or alienated or upset in that social or evaluative kind of way.
Okay. Now, certainly in your book, when you're talking about that first type, that something is distressing at school, you do go into not exactly cognitive behavior therapy, but pieces of that, the idea of talking about anxiety, how to deal with anxiety, stress related to anxiety. Do you find that strategy is often more successful with younger students, equally successful with older and younger students? It varies, there because of the variables for the student based on age.
The general concept of anxiety management is going to apply to both groups, but with the younger group, we really have to make it a little bit more simplified given their cognitive developmental level. So we don't use a lot of the cognitive techniques on the elementary school kids like we would with the middle schoolers or the high schoolers. Mm-hmm. So with the younger kids, we focus a lot more on somatic anxiety management. We focus on relaxation training, breathing retraining, and gradual reentry into school. So that could be a variety of different ways, but we if they've been out of school for some period of time, we'll gradually reintegrate them as they're practicing the anxiety management techniques, and then we can talk to them about anything that happened at school that might have been particularly distressing, and maybe how they could have solved a certain problem or dealt with a certain kid a certain way. So there's some problem solving that goes along with it as well. With the older kids, though, they usually will have a lot more refined cognitive distortions about what's going on in a particular anxiety-provoking situation. So we're usually able to zero in on those a little bit more. But the other components are going to remain, which is sort of the gradual reentry into school, the somatic anxiety management kind of techniques. But it's going to be a little bit of a broader approach with the older kids.
Mm-hmm, mm-hmm. So I have personally seen more school refusal in the past, few years professionally, and I think there's been a difference between the older and younger students, just like you would expect. Do you ever feel that there are school refusal-esque or like behaviors that happen in younger students that often will go unnoticed until they become school refusal, or is that not really a pattern that you've noticed?
No, that's definitely true. You get a lot of early warning signs that sort of simmer in elementary school for quite a while. So you could have kids that are just very distressed about going to school, or they miss a certain number of days, or the parents were able to sort of paper over the absences with some excused notes and things like that. But then the real problem is when they hit middle school. So middle school, the first semester of middle school, is usually a high spike time for absenteeism because a lot of these kids are suddenly faced with a lot more schoolwork and a lot more teachers, more diverse peers, a lot more noise and chaos and responsibility. Mm-hmm. So there's a lot more demands on their social and academic competence once they hit middle school. And that's where a lot of times you'll see a spike in absenteeism. Mm-hmm. And then usually by the time they hit 8th grade, they get more disconnected from school, and that can set them up later for a dropout in high school.
When it comes to working with high school students, I mean, you mentioned it in the book, it seems like you're dealing with those complex cases, multiple functions of school refusal. Do you have any starter suggestions you have for working with older students versus younger students? Because I know it does seem like those cases tend to be, maybe they were more about the distress around school, but now there's the extra social component of I haven't been in school and my friends are going to ask. And now I'm also behind in my schoolwork. And actually, mom and dad have let me keep my phone this whole month I haven't been in school. So why the heck would I ever want to go back to school? And it does sort of feel like, well, now every function is in place and there's absolutely nothing to be done. What are we going to do here? So I would love to hear any advice you have for working with the middle and high school students.
Yeah, no, I hear what you're saying. For a lot of those kind of kids, especially if they've been out of school for a long period of time or there's been a lot of problems going to school for a long period of time, the first few questions we really have to ask is what their academic status is. Mm-hmm. So how far behind are they in terms of accruing credits toward graduation? What do their grades look like? What does their absenteeism look like? If it's fairly severe, if they've been out of school for quite a bit over the last couple of years or they've been failing all their classes, then the first legitimate question is, well, is this really the right setting for them? Mm-hmm. Are they even able to graduate in this kind of setting? So for a lot of those kids, we'll focus just as much on finding the right academic placement for them as we do the mental health aspect. And so we work pretty closely with the schools to figure out what our options are in that regard. And it could be an online situation. It could be a hybrid situation where they do some online and then some in class. It could be that they go to school part of the time and then they have a supplemental summer program. But we have to kind of figure out what the unique academic fit is going to be for them that allows them to graduate. And really that's the bottom line in a lot of these cases, is you just want to get them past the graduation line.
Mm-hmm.
In addition, of course, you want to deal with the mental health issues that might be going on, but we do focus a lot on working with the school officials, the guidance counselors in particular, about what is the alternative academic pathway that's going to allow these kids to graduate, even if it's a year late or, with a different timeline or a different set of credit requirements or something like that they might be eligible for.
Mm-hmm. Now, when it comes to looking at alternate means of getting to graduation, is there sort of a good rule of thumb for when that's appropriate or not? Because I know for students with anxiety, if they really are, either it's coming out from the assessment tool, it's coming out from questionnaires, they have a long history of almost debilitating anxiety. Is there a point at which that is okay, even though allowing them to do most of their work at home is potentially going to set them up for not getting the treatment that they need for their anxiety? Or they graduate and then it's like, well, the school's done. Now, go into the big wide world where you still have a significant anxiety problem.
Yeah, it's a really good question. It's a tremendous gray area as to whether or not how you want to tilt the scale, right? So we've had a lot of cases where clearly the child's been anxious and depressed for many years, but they've been out of school for 3 or 4 years as a result. There's almost no way you're going to get them back into a regular classroom setting. So the priority really has to be graduation, right? How do we at least get them in a situation where they're going to be able to be successful to take the next step into adulthood? And maybe then they can work on some of the more mental health issues once they're more integrated into an employment role or some kind of other academic role. But at the same time, I always tell people you don't necessarily want to use online education as a means to sort of shield the child from difficulty at school. So if they haven't been out of school for a very long period of time, my first impulse would be to try to get them back into a regular classroom setting, because then they're going to be more skilled at managing their anxiety, at dealing with other people and performing in front of others and things like that. But once you get past a year or so where they've been out of school, then it's really much more difficult, especially if they're in high school, and especially if they do have severe anxiety or depression, to sort of get them back full time. Mm-hmm. So it's a clinical judgment kind of thing. But again, the general rule is that the longer the time that they've been physically out of school, the more likely it's going to be that it's going to be much more difficult to get them back into a regular classroom setting.
Mm-hmm. Do you have any tips that you can share sort of beyond what's in your work on dealing with the kind of the call of the tangible, I guess, for the older students, or for really any of the students? But I think, one of the things I've noticed working with a lot of families is some parents, especially if they're a little bit older, don't quite see that, say, a child's phone or access to an iPad or some sort of a tablet really is like the reinforcer for a lot of students these days, a lot of children these days, because it allows them to have their social interaction, it allows them to have games, it allows them to have TV. And I know a lot of parents are sort of loath to take that away from them. Have you noticed kind of a change in sort of what the tangible has been for the students you've worked with?
Yeah, I definitely. I mean, over the years, and dealing with my own teenagers, I have the same kind of issue. So I mean, they're very attached to their devices and the phones, but it's a matter of putting smart limits on it. So whether they're allowed to text during certain times, if you can carve out a certain homework time, and so it's a device-free time, I think that's advisable. A lot of families sort of make the mistake of not necessarily carving out a specific homework time. So it's best if, when kids come home from school, that's immediate homework time. They shouldn't wait until later in the evening. If they can sort of get in the habit of doing their work earlier and then having dinner and then having the devices as sort of a relaxing time later on, that's going to be a little bit more advisable. And then, of course, different schools have different regulations about cell phones and what you can do during the course of the day. A lot of parents like the fact that the kids have cell phones because they can keep track of them, or at least they know where they are, and there's an advantage to that. But I think The answer is just going to be moderation. It has to be setting smart limits during times when the child really has to be focused on academics and getting ready for school in the morning in particular.
Mm-hmm. For students who are engaged in school refusal behavior, have you had to work with them and with parents to set limits on, even though everyone expects to have a cell phone, if you don't meet, the goal that we set as a group for the day, then that phone's not available? Or has that been something that parents are kind of loath to say, oh, I don't want to make that part of the contingency?
Well, I actually try to use it more as an incentive than a punishment. I mean, sometimes we have gone that route, but a common scenario we have with the younger kids is that they'll call their parents 6 or 10 times a day on the cell to see if they're okay or if they can get them to pick them up. And so we'll try to set a limit so that if they're in class and they're functioning independently for the morning, then they get a reward of being able to talk to their parents for 2 minutes at lunchtime in the guidance counselor's office or something like that. But if they had a problem going to school that morning, then they lose that reward. So I try to use it as more of an incentive than anything else. I mean, the fact is the technology and the devices, they're part of our fabric now, and so it's going to be difficult to sort of take them away. But at the same time, I do think it's a useful tool as a punitive measure in some cases. If the child agreed that they were going to go to school for a certain amount of time and didn't, that seems like a reasonable disincentive, is to lose their phone for a certain amount of time that night.
Mm-hmm. Mm-hmm. Now, how do you typically work with families when one of the functions of school refusal has to do with access to peers, specifically peers who possibly have access to drugs or alcohol during the school day? I feel like then you're dealing with, so many complicated functions that there's no way to sort of just have the school, even with consultation, resolve that on their own.
Yeah, that's true. I mean, it's always a particular challenge. I mean, we'll work with teenagers in those kind of cases to avoid high-risk situations. So we try to identify what the situations, the times and places at school, for example, that are most high risk in terms of others tempting them to miss school or making offers for more delinquent kind of behavior, and try to short-circuit those kind of scenarios. So if the kid knows, for example, well, when I go to my locker at 11:30 right before lunch, everybody comes over and says, hey, let's do this. Well, then maybe missing that particular time period at your locker is a good way to short circuit it. We also try to give them a lot of skills to sort of decline offers for that kind of stuff in a more socially acceptable kind of way. So a lot of it is just sort of, it's going to be uniquely tailored to that particular child, but a lot of it is geared to sort of more pro-social kind of responses to those kinds of things, and focusing more on what the child needs to accomplish in order to be able to spend time with their friends, for example, on the weekend.
Do you have any knowledge of any programs to sort of help kids either resist the temptation of friends to engage in drugs and alcohol? Are there any that you know of that are particularly successful, or is it more individualized? What it seems like it's going to work from my strategies I have? What seems like it'll work for this one client?
The technique that we borrowed from the substance abuse literature is peer refusal skills training. So that's sort of along the lines of what I was talking about. You teach the individual to decline different offers for delinquent behavior in more socially acceptable kinds of ways. So there's a pretty full literature on that, and so that's what we've tried to borrow from.
Okay. I had a principal that liked to use the whole "my wife says I can't go" or "my wife says I can't do" it technique, but he found it didn't work as well with the middle schoolers in his building.
Well, I have told the kids to, blame it on their parents, blame it on the therapist if they want to, to put the onus on somebody else. I don't really have a problem being the bad guy in that situation.
This is very true. Now, when working with families, it does seem, and it's certainly in your book, one of the pieces of dealing with school refusal is the education of the family. But what do you do when you have a family who either can't or seemingly won't listen to you, and they're just, nope, that's not the problem, they're sick, we're just going to go to the doctor over and over? Nope, the problem is when they won't sort of listen as to what the steps might be to get the child back in school.
Yeah, it's a good question. It's one that's faced a lot by school officials. So when I give workshops to school districts, that's the common divide between the kind of cases that I see and the kind of cases that they see. So the kind of cases that I see are the parents are a little bit more motivated because they're coming to our clinic and they're trying to solve the problem. But the cases that the school officials are seeing are parents that don't want to be contacted, or they're belligerent or suspicious about what's happening. And so what I try to talk to the school officials about is to try not to focus on long-term solutions. Don't try not to focus on a plan that's going to be a whole semester long, but try to focus on something that's just sort of week to week or sometimes even day to day. Because a lot of times it's those first couple of weeks that are most important. If you can get the kid back into school, even for a short period of time, if they're physically in the school building, that's a big step forward. So I tell them, try to work with the parents in a very collaborative kind of way. Also, make sure that the parents can get a hold of you at a certain time and place, because that's a big complaint that a lot of parents have, is they can't get a hold of anybody at school. So if they know who the point person is, who they can problem solve with, especially in the morning hours, that's going to be helpful. And then to develop accommodation plans. Is there a 504 plan or an IEP that can be developed that might be able to put in steps for things like part-time school attendance and anxiety management techniques or other kinds of things. And each jurisdiction is a little different in terms of whether they're receptive to that, but those are some of the things that we've used before. So a lot of it is just trying to work with parents on very short-term goals over the next few days, as opposed to sort of a grand plan.
And I know certainly in your book, the recommendation being that whatever your plan is, short-term, long-term, that it is very well spelled out and the parents have as few questions, if any, before you even start implementing, correct? Because you don't want them to feel like you're trying to do something that wasn't agreed upon. You want to make sure that they feel a part of the team, I would suspect, correct?
That's right. And you want to make sure that everybody knows exactly what's going to happen the next day. So the child, the parents, everybody, the school officials, and that everybody's exactly on the same page. And that everybody knows about what's going to happen if the child refuses or shows a certain kind of resistant behavior. What is everybody else going to do in that situation? So you want to make sure that the parents in particular are very well prepared for any kind of contingent behavior that can come up and what they're going to do in response to that. And the other thing I tell parents is it doesn't really matter what time you get the child to school. It's better that they go to school. I mean, even if you get them to school and it's 10:30 in the morning, if they're there from 10:30 to the end of the day, that's better than missing an entire day. So we always try to make sure that we focus on getting at least some school attendance during the course of the day.
One of the questions that I know I've been asked a lot by various school administrators and teachers is, at what point do other services outside of the school get involved, whether that's mental health services or sometimes even state services like the Department of Children and Families or even the police? Do you have any suggestions that you go to? I know it's going to be individualized from case to case, but any sort of like general patterns that you've noticed?
Well, definitely when the child's absenteeism is getting to the point where it's interfering with the family's routine or the child's daily functioning, that's a cue that's more of a mental health issue to start with. So you've got a situation where maybe the child's been out of school for a couple of weeks. Now they're falling behind in their classes and the family is, somebody has to stay home with the child, and so they're missing work. I mean, that's creating a lot of disruption and distress in the family, and so I would classify that as a mental health issue. If there's dangerous behavior going on, so the child is running out of the school building during the course of the day, or they're joyriding with friends, or they're out with friends and there's drug use involved, then I think police reaction is certainly mandated in that situation. And we've utilized school police or metro police in those kind of cases, to try to reduce the dangerous behavior. So, and then for DCFS kind of things, some school districts have a policy where if the child has a certain number of unexcused absences, they will make a referral to those kind of agencies, child protective agencies, for educational neglect. So that's sort of a legal or a parenting issue that sometimes comes into play as well. But I would say in general, it's going to be more the first category. It's going to usually be a mental health issue. But again, once it sort of crosses the line and it's disrupting the family's or the child's daily life routine, then we usually offer services at that point.
Now, when looking at planning ahead for creating an environment in which there is less school refusal, I know there's been some work kind of out in maybe the Midwest and some in New York looking at technology like, cell phone nudges to try to get parents, hey, by the way, your kid's not coming to school. Some initiatives on, kids shouldn't miss any school ever because every day missed decreases their potential for grade point average, by some percent. Do you have a sort of a number or a pattern that you recommend schools sort of see as this is when you need to be stepping in or doing more than just the phone call home?
Yeah, that's a tricky one because most school districts will have their own definition of what problematic absenteeism is. So a typical one is 10 unexcused absences in one semester, which is a 15-week period. But the problem is if you have a child that's missing that many days in a 15-week period, chances are they have many more excused absences. And even if they have 10 absences altogether, that places them at significant risk for academic problems and being able to finish the school year by having passing grades. So I always tell school officials when I give my workshops that you really want to step in as soon as the child is starting to have difficulty going to school. So even if it's a day or two, outside of a pure illness kind of situation, if they're having difficulty coming, they show those early warning signs, or if they've even missed just 1 or 2 days, especially in a new semester of a new school. That's really when you want to sort of step in and say, hey, what's going on? Are there any adjustment problems? Or is there anything that we can sort of tweak, schedule-wise, or, how is it that we can sort of get you more socially integrated or something like that? I really don't like the sort of wait to fail approach, which is sort of wait until the child has a whole bunch of absences and then you step in. I much more advocate more of a preventative, a more proactive kind of focus with this kind of problem.
In sort of that same tack of staying proactive, are there steps that you have seen either schools take for the positive or potentially for the negative that have had an impact on school refusal behavior? I know like social emotional learning seems to be sort of I don't want to call it a buzzword, but I do seem to, I see a lot of articles about social emotional learning in schools and our kids don't have, social emotional skills. Any thoughts?
Yeah, actually, social emotional learning is part of general Tier 1 strategies for absenteeism. So Tier 1 is more preventative, more school-wide kinds of programs that are designed to reduce the overall prevalence of a given problem, like reading problems or behavioral disorders, or what we've tried to do is extend that model more to school absenteeism. So yeah, there are a lot of things that schools can do at that Tier 1 level to try to convey that school attendance is a highly valued commodity. A lot of schools sort of make the mistake of just relying on a punitive model when there's absenteeism and just sort of assuming that the kids are going to come to school. But the opposite model is conveying the idea that school attendance is a highly valued kind of thing. And you can incorporate that into classes like health classes. You can have assemblies on that. You can have teachers that are greeting students. You can change the general climate of the school to make it a more inviting kind of atmosphere. But a lot of it is it has to be sort of a school-wide initiative to do those things. And social emotional learning is part of that because what you're doing is you're teaching the kids a variety of different skills that they need to be successful in their everyday life, whether it's study skills or organizational skills or social skills that they can use to be successful in school. And kids are going to be more likely to want to come to school if they're socially connected and they understand what's happening in their classroom. It's
very true. I find it very strange sometimes that some of the techniques that I see used in social emotional learning sort of feel like the general ones I used to use when I was working as a one-to-one with children with autism in a private school way back when, of if you make yourself valued and if I have the reinforcers that you like, I'm a part of the the enforcers you like, children inherently will enjoy your presence and want to listen to your instructions more. And sometimes it seems odd that that's almost like a lost art in schools.
No, I totally get it. And there's a lot of parallels there. Just with my own kids, I know how well connected they are to school when they tell me at the dinner table what their teacher said in class. And their teacher made it interesting, and their teacher conveyed different real world kind of ideas. They applied what they were learning in class to the real world, and it really connected with them, and they got that. But it also made it a very positive and inviting kind of learning experience. And so they're more motivated to go back to school to learn those kinds of things if that's the kind of classroom, where those techniques are being engaged.
I was looking online today, and I noticed that there's a second edition of Helping School Refusing Children and Their Parents out. It looks like it just came out recently. Is that correct?
That's true.
Oh boy, I wish. Well, I read mine over the summer. I had to get one of the secondhand versions for a little more money. Are there any big changes in the second edition?
So the second edition focuses a lot on the multi-tier model, which is looking at Tier 1 strategies, sort of a focus on what we talked about, more preventative kind of things. Most of the book is going to be focused on Tier 2, so those emerging acute kind of problems. But then there's a lot more material on Tier 3 kind of problems, more chronic severe absenteeism, and what are some of the different recommendations for those kind of cases. So I think it's a little bit of a better fit for a lot of school officials because it does have a lot more information on the chronic and severe cases, which is what they're often asking about.
Okay. Excellent. I maybe I need to get the new edition as well. Add it to my professional bookshelf at the office to look smarter, I guess. It was an excellent read. Did you rewrite sections of it? Did you have to sort of go back and review all your old literature to redo it, or it's just sort of second nature at this point?
No, I mean, a lot of it is, I did a 2016 book on the multi-tier system, looking at school absenteeism, and I realized as I was writing that book that there were a lot of those kind of concepts that I would have wanted to have put in the educator book that I wish I had way back when. So I asked Oxford if I could do the second edition with that in mind, and they said yeah. So I think it's a lot more streamlined, and I think it's a little bit more relevant to the real-world aspects of school officials, that particular book.
Okay, excellent. I know you also have a version on school refusal that focuses on the cognitive behavior therapy portion of helping students. Is that more a totally separate book, more advanced version of sort of some of the concepts you review in the book on school refusal behavior?
Yeah, that is a more advanced version. It's much more detailed. It's generally meant for clinicians who are seeing cases in their offices, so more mental health professionals, but that goes into a very detailed session-by-session kind of outline of the different techniques and much more detailed than some of the other books. But the problem is with school officials, they don't really have the time necessarily to implement all those kinds of things. They need something a little bit more nuts and bolts and quick, and so that's what the educator book was designed for.
Mm-hmm. Now, would you say that book was, this is sort of more from my own personal knowledge, as someone with I would say a working knowledge of CBT. I've never practiced it. I've never been formally trained in it, but would that book be accessible to me? You know, I generally know what CBT is all about, but I'm not a practitioner of it. Would I be able to understand it? Would I be frustrated reading it?
I don't think so. I mean, I think it's something should be accessible to basically everybody that reads it. I mean, I'm very much a nuts and bolts kind of guy, so I want to know what works and what you can use in different situations, and so that's what's in the book. So a lot of it is, if you have this kind of situation, this is what you want to do, and you know, these are the different kind of things you can plug into that particular case. Now, keep in mind, of course, that a lot of these cases are, as we mentioned earlier, kind of messy, and so you're going to have to sort of borrow techniques from maybe different chapters. But yeah, they're designed to be read today and implemented tomorrow kind of thing. It's because a lot of these cases have such an urgency to them, you know, and there's so many of these kids that the only person they're ever going to see for their absentee problem is someone at school, for example, and they're not going to see a mental health professional, that people really need these sort of plug-in ready kinds of techniques, and that's what we've tried to work on.
Mm-hmm. That's excellent. Now, when I was doing kind of initial research for our initial show on school refusal behavior and sort of in my own practice, you really were the school refusal research name out there. Are there other researchers who are looking more into school refusal behavior, or have you cornered the market and you said all there is to say about it?
No, there's lots of people that do research on it. Last year I was in the Netherlands. There was a large conference of worldwide researchers that were gathered together. It's out there. I mean, we published a lot in this particular area, but there's a lot of other people that have contributed a lot of ideas as well. There's certainly a large truancy literature that's out there that focuses a lot of more delinquent kind of absenteeism, and there's some large scale studies in that area as well. So it's a worldwide problematic absenteeism, and there's certainly a lot of people in a lot of different countries that are looking at it.
Mm-hmm. Now, your book's for professionals. I believe there was a version that you written specifically for parents to read. Is that still up to date, or is there an updated version of that book?
There's one edition of that.
Okay.
Yeah, I have not updated that since then, but that's on my agenda at some point. Yeah, but yeah, there is one out there.
Okay, what was the title of that book?
Getting Your Child to Say Yes to School.
Oh, that's a good title.
Yeah.
Did you get to think of your own titles, or does the publisher have suggestions?
It's both. It's a negotiation. I think that one, they won the negotiation. That's something they wanted, something a little bit more positive and catchy, so they went for that. Yeah.
Yours was more dour about school, like school's tough, deal with it, or something. No.
Yeah, mine tend to be a little more dry, but they want a little bit more attractive title, so we work it out.
Oh, well, it's an interesting view into the book process. I've never done anything related to publishing, so that's a fun aside.
So it's a world it's a world all its own. Yeah.
Now, I really appreciate that you took the time to talk to us today, Dr. Kearney. One of the things I love about a lot of your research and in your book is you have a fabulous way of either taking, whether they're case studies or amalgamations of clients you've worked with, breaking down the process of helping them with school refusal. Do you happen to have, and it's okay if you don't, I'm putting you on the spot, any kind of school refusal anecdotes that either you haven't published or that are on your mind that you wouldn't mind sharing, just as an example of the school refusal process?
Well, not off the top of my head. I mean, I guess, I would say with these kind of cases, as I mentioned at the beginning, they're so myriad in terms of their presentation that, I mean, there are certain threads that run through a lot of these cases, and that's what we've tried to focus on in our research are the common threads, but there's tremendous amount of innovation that is needed for each of these kind of cases. And you run into really unique kind of situations. I've had kids that will refuse to get out of the car to come into our clinic, and I've had to go out and do parking lot therapy. And, you've had kids where you've had to go down to the school because they just cannot make it into school. I've actually walked kids into the school 6 feet at a time sometimes. We've had kids that will have certain somatic complaints, really severe somatic complaints, Monday through Friday, but not at all on Saturday and Sunday. You get real extreme, interesting kind of behaviors. And even though a lot of what we've come up with is generally applicable to most of these cases, you're still going to get a lot of these challenging kind of scenarios where you're going to have to sort of use your best clinical judgment to sort of decide what to do. And I think it's important not to read just our literature, but a lot of related kind of literatures in child behavior disorders. We talked about borrowing from the substance use literature, for example, that I think are necessary for this population, especially when you get to the high school level.
Parking lot therapy, is that just talking to the student in the parking lot, or is it?
Yeah, it's just sort of cajoling them to come in. We've had a lot of situations where parents will have lied to their children about where they're going, and
because go to Disney World.
They're afraid they're going to refuse to come to the clinic, and so I've had to sort of convince them that we're not going to hurt them or do anything terrible to them and get them to come in.
Have you ever needed to be hands-on or do escorts? I know you recommend that is really a last resort and it would only be used with very young children, but has it ever become a part of treatment for an older student where you had to nudge them over those last couple inches, or you were really worried they were about to take off and go somewhere that the police weren't going to be able to get there in time?
Well, for the older kids, if it's an anxiety-related situation, we have done escorts where we've walked them to class, or we've had other people do it that are more natural to their environment. It's better if you have somebody that's more natural to their environment, like a guidance counselor or a peer or somebody like that. We use peers sometimes in that situation. If it's more of an escape situation, then we're going to rely a little bit more on the school officials. We're going to make sure we kind of alert them as to what's going on, and so that they can sort of short-circuit any kind of surreptitious departure from the school building. But a lot of times kids, they don't, especially in high school, they don't necessarily want anything that's going to draw attention from other people. So anything that has to be done more on the sly would be their preference. But we have had a lot of kids who are so anxious that, we did need to sort of ease the transition for them ourselves and just kind of a small bit at a time.
Dr. Kearney, thank you so much for taking the time to talk today. The Helping School Refusing Children and Their Parents second edition is out. You can get it on, I just saw today, you can get it on Amazon. That seems to be where everyone gets books nowadays. I don't know if there's anywhere else that they should be going to. Any other publications that you think would be good for our audience, mostly behavior analysts?
There's one that's now in press with Oxford, and that's actually looking at the nuts and bolts treatment for mental health professionals and school officials. So it's a much more direct version of what can be done and what kind of specific questions you can ask and how you can sort of blend the assessment, consultation, and early intervention process almost immediately into one episode or one session. So that should be out in 2019.
And that'll just be available wherever books are sold, kind of?
Yeah, I imagine it'll be available sometime in the summer, but I'm not exactly sure when. But yeah, sometime this year. Oh,
good. Well, summer reading is always good especially for education professionals who have some time off to read.
Yeah, especially before the school year starts. Yep.
That's when I did most of my school refusal reading was over the summer. Kind of kicked back and looked at school refusal literature. It was a lot of fun.
There you go.
All right. Well, Dr. Kearney, thank you so very, very much. It was a real pleasure talking to you.
You too. Thanks for having me.
Thanks once again to Dr. Kearney for taking the time to talk to us all about school refusal behavior. It was a real, I think I said that like 50 times during the interview, a real treat to get to speak with him about this very important issue. We really hope you enjoyed this bonus episode, and if you like the bonus episode, hey, maybe there's a chance that you'd like a regular episode of ABA Inside Track. We're a weekly podcast, and every episode we look at a specific topic in the field of behavior analysis, and we read some articles on that topic and discuss the research, sort of like an old-fashioned journal club. So if you haven't tuned into our regular episodes, please do. We also have a number of bonus episodes, too, with lots of other great interviews. If you like the show, hey, why don't you check us out on Apple Podcasts, on Spotify, Stitcher, wherever you get your podcasts. Feel free to like or subscribe to the show. You can also find us everywhere on social media, Instagram, Twitter, and Facebook as ABA Inside Track. We post these episodes on YouTube as well, or you can always go to the website abainsidetrack.com or send us an email at abainsidetrack@gmail.com. And don't forget, if you like continuing education credits for listening to podcasts, and who doesn't, while these bonus episodes don't count for CEs, our regular episodes do. So hey, if you like this one, you need some CEs, why not check out the regular show? Anyway, we'll be back with another full-length episode very soon. But until then, keep responding. Bye!